Good to catch up with you. Congratulations again on passing your exam.
Thank you.
Really excited today for you to join us on the masterclass. Divya is one of the alumnus of the program. Today, she's agreed to come and tell us a little bit about how she prepared, her insights. I know some of you might be sitting the exam next week and are a bit anxious. So, we're going to get into how to manage this exam anxiety and much more. How did you prepare for the SC exam, Divya?
So I think initially we started speaking probably from October. And I think that's sort of when the initial preparation started. And then I knew I was going to sit the exam in February. So it gave me sort of 4 months. And I think when we initially spoke, I was quite clueless about what the exam actually entailed, especially because it was a new exam. I didn't really have much structure to consultations at all. And I think generally there was quite like a lot of self-doubt, and I wasn't aware of sort of the capabilities I had. And then when we were sort of working together each session, I sort of picked up and learned new things. And I think one of the biggest things was sort of just managing time, and realizing the importance of actually completing your data gathering within 5 minutes, if not 6 minutes, because as you see from the feedback, is essentially that the clinical management is weighted much more than the data gathering. So it's really important that you have a good 6 or 7 minutes to actually focus on the management section.
Time management is a major challenge for trainees. What were the things that you found that you were taking a long time and you managed to do to compress your consultation, Divya?
Initially, you're kind of a bit wary of not collecting the full history. And you always think, oh, I forgot to ask this or that. And then I think sort of as you sort of keep practicing more, you notice that it doesn't really matter if there's certain things that you've missed out. And it's about prioritizing your questions when you are going through that data gathering, and making sure that you've asked the important questions. And if you've missed certain things, it doesn't actually matter.
Yeah, that's a very important point. So you don't have to go through an exhaustive list of inquiry, but you need to answer vital questions to make a safe assessment. So you figured out that there were things that you didn't need to ask. Could you give us example of things that you're asking that you didn't have to?
I think even if you feel like it's part of the topic. So I remember there was a gynae case, and I didn't sort of ask about sexually transmitted infections, and I thought I was going to fail the case, but actually it didn't really matter. Um, so certain things like that you think is important to ask, it doesn't necessarily mean that you're going to fail the case if you've missed certain things.
And sometimes your perception of how a case is going might be completely different to how the examiner mark you. So I spoke with some trainees who thought they were going to fail a case, but actually they passed that case. But then there was a case that they thought that they did well, failed completely. So could you give us an idea of on the day, how did you prepare and what was it like?
So on the day of the exam, I made sure that I logged in early. I was ready for the exam, and they normally do like an ID check, and then that whole ID check is 30 minutes. And so it can be quite nerve-wracking when you're just sitting there. So it's kind of just preparing yourself, taking a few deep breaths, and trying to relax as much as you can. And then during it is quite a long exam in terms of back-to-back cases, and it's really important to forget whatever happened in the previous case and try your best for the next case to come. And initially I was quite worried about all the IT issues, but on the day I did have an issue where the sound cut out for 30 seconds during one of my cases, and they actually let me repeat it at the end. So actually it's not something to be worried about.
It can actually play in your advantage if you're rerunning a case because you kind of already done it and can actually anticipate what might be coming up. So then, with regards to exam anxiety, then you mentioned to get deep breath. How did you manage to be present in the consultation? Sometimes there's a lot of questions you might be thinking and doubting yourself.
I think it's sort of trying to simplify this exam as much as you can. And actually, the key to I think to do well in this exam is actually just to listen to what the patient is saying, because at the end of the day, they have a script to get through. And as long as you're picking up on the relevant cues, you're going to go down the right path. And I think if you are sort of not really listening to what they've got to say, you can completely miss the actual plot of the whole case.
Listening is really important, and being curious and wanting to know more is so important. Could you tell us how did you structure your consultation, Divya?
So I kept it as simple as I could, and sort of even in the exam setting, there's a timer, so you can sort of see, okay, I'm sort of at the 5 minute mark of my data gathering. I tried to, during the data gathering, I tried to keep each bit separate. So in terms of ICE, so let the patient speak for about 30 seconds to a minute, and then I did an ICE at the beginning. Then I sort of did either sort of taking the red flag history or doing a bit of psychosocial. And then sort of when I was coming towards the end of the data gathering, I iced again just to make sure I didn't miss out anything that the patient was concerned about or sort of what they were expecting. And then sometimes I would summarize sort of the important findings to sort of give my diagnosis or differential. So, for instance, if it was a case of chest pain and it was quite clear that there were concerning features of cardiac chest pain and they needed to go in, then I would sort of state the clear points to sort of encourage the patient that this is a concerning symptom and that they need to go to A&E. So then that would sort of support my diagnosis and lead to my management plan. And with the management plan, I think I'd lay out the options first, and then sort of coming to an informed decision with the patient after.
That's a great point. So you lay the options and then discuss it. Did you find that there were stations where you didn't have any clue what was going on, or there was a lot of uncertainty?
I actually I don't think so. I think all the cases were quite fair, and pretty much day-to-day cases that you'd see. So I didn't feel anything was off guard. I think there was one or two where I thought it was too simple in a way, and I kept feeling like I was missing something. But actually, when you get the feedback, it was actually just a simple case. So.
So it sounds like you were well prepared. How long did you give yourself to prepare for the exam?
So I think we initially started speaking in October and then the exam was in February, so about 4 months.
And were you practicing in study groups as well?
Yeah, so I had sort of three different study groups. So I had one from my VTS group, and then I think I formulated one from this group. And so then I had sort of different groups sort of experiencing different cases and getting different feedback, which I found really helpful.
So it's good to have various study groups, not just practicing with one person. What was things that if you knew now, you would have done differently, Divya?
I think sort of probably with the self-doubt, I think I didn't feel confident initially about passing this exam. And I think if I hadn't been so worried about that, because essentially for October, the whole month of October, I didn't really feel like I was focusing. So in reality, I probably only did 3 months of preparation. And I think probably the most important thing is that day to day, we see so many patients that actually I think this exam is quite possible for everyone. So just not having that self-doubt.
That doubt that some of you might have is quite natural. And the way that you can tackle it is by practicing, refining your consultation. And then when you're going to sit the exam, you'll be able to get in the flow and consult. And even if you might find that the case is challenging, chances are you would have experienced a similar type of scenario in your exam, in your practice, because many of the cases reflect general practice, although there might be some complexity. But if you practice enough, then you'll be on a very good ground and you're not going to be thrown off. Was there anything in particular that you find useful among the resources you use, Divya?
So I think sort of the case bank that you had was really useful because it essentially covered all of the key scenarios that could possibly come up. So I think sort of watching those videos, but then also practicing the cases in my group was quite useful.
How did you go about choosing which case to prepare and practice and refine? Because there's a lot of cases people are doing. Some people do a lot of cases over hundreds, but not the quality. What were you doing in that regard?
So I personally didn't do many, lots of different ones. I actually preferred to go over the ones that didn't go so well many times so that I felt confident if something difficult, like a difficult conversation was going to come up, sort of breaking bad news or sort of an ethical scenario of HIV or something like that. I would practice those quite a lot. So then I felt confident going ahead in the exam to do any of those difficult discussions.
I remember we did a case of negotiation, and that was quite well the way you consulted. So, what were your ways of practicing these challenging cases?
So initially, I think we did one. I think initially when we did it, it was something. I think it was a sleeping pill one, and I think the patient just wanted the sleeping pill. And I think initially when we first practiced it, I was really thrown off. And the first time around, it didn't go very well. And I think sort of learning from that experience, it was mainly sort of exploring the patient's expectations in a bit more detail, why they actually wanted the sleeping tablet, for instance, and sort of other ways that we could help that wasn't giving in to patient expectations, but trying to help in other ways.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one to one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam. In terms of your preparation, it looks like you are very organized and you're practicing a lot. Give us numbers on a weekly basis, like a month before the exam. What was the frequency you were practicing, Divya?
So actually, I think December we didn't really actually practice anything, so it was mainly January that we were practicing really, and then that was sort of 3 times a week. So the month before the exam, we were practicing 3 times a week.
And how many cases were you doing in the practice?
So we'd be doing about 2 each, and the study groups had 3 or 4 people in it. So getting through 6 cases roughly in each session.
What were the things that you thought was about this exam, and then you found out maybe I was wrong, or maybe you had some misconception, if any?
The idea that they're trying to trick you or there's some hidden agenda in these cases. It wasn't like that at all. And I think if you're asking the right questions, you're going to get the information. So I think there was some idea that if you've asked them what they're concerned about, they're not going to tell you. But actually, if you're asking it directly, they sort of tell you exactly what you need to know.
So it really depends on the quality of the question then. Um, if you're not asking the right question, then the simulator can't really give you the answer. But if you know how to ask a question, then they will give you the information to help you. Any advice you would give to somebody who is going to sit the exam next week?
I think sort of if it's next week, it's sort of just making sure that you're up to date with the clinical knowledge. Because I remember a week before, I was sort of just looking through NICE guidelines just to make sure that I was, the simple things like acne, um, just sort of day-to-day things that we see, that I knew all of the guidelines for common topics, really.
Yeah, so it's very important to revisit things that you know you have areas of weaknesses and mapping it on the blueprint, the 12 clinical experience groups, so that you're using your time effectively, especially if you don't have a long time to go for the exam. So thank you very much for sharing your insights with us, Divya. I'm glad that you've managed to get through, and hopefully your insights today has helped a lot of trainees. Um, have you got any last piece of advice for trainees?
No, I guess sort of it is possible to pass the exam, and actually it is quite a fair exam compared to the RCA or CSA before. I think it's definitely a fair exam.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye bye.